Growing crisis in California put in the spotlight by Fox 40 last week. Millions of children in the state who rely on the Dent-A-Cal program cannot get access to the proper care they need, and that is according to a recent audit in the state-run agency. Hi, everyone. I'm Stephanie Cruz.
And I'm Ty Steele, and now we're learning that it's not just children that aren't getting Dent-A-Cal care. It's adults with special needs. And
Fox 40's Joe Khalil joins us live from Sacramento now with what some say is the problem. Joe?
That's right. It's not that, these adults aren't getting the access. It's just taking much longer. We're talking about weeks to a matter of several months, even almost a year. And the people that we spoke with today deal with this issue every single day. They tell us that the healthcare system is to blame.
Turn around. Have a seat.
It used to take Karen Farnsworth just a few weeks to schedule a doctor or dental appointment for Terry O'Donnell. He's severely autistic.
Now, just to get the preventative care, it takes 2 to 3 months, and it's at least sometimes up to 6 months.
Farnsworth, director of California programs for the autistic, says that's a direct result of new guidelines the Department of Health Care Services put in place for Dent-A-Cal patients. She says patients like Terry suffer sudden outbursts at medical appointments.
Do you want to go get coffee? The sights, the sounds, the smells can be really frightening for them.
And need to be put under for dental treatment. Dent-A-Cal's new anesthesia policies make that harder to do. Now, Terry will need to prove he meets a standard for anesthesia. Dentists need to rule out other weaker alternatives, and he'll have to be re-evaluated every year.
It just creates more roadblocks for him.
Dentist Rodney Bogau sees special needs patients. He says that's simply unrealistic. New rules also mandate the same anesthesiologist who sees each patient has to meet with them before an appointment.
And that's an almost impossible task to accomplish because the anesthesia groups, for the most part, they don't even know which patients they're going to be seeing until the night before.
All of these new rules, on top of pay that Bogau says won't even cover costs, have led most Dent-A-Cal dentists to stop treating special needs adults altogether.
Come out and just observe us, just for a day, and see the struggles that we go through.
Who loses out? Those who often can't speak up for themselves.
It's really hard to watch. I mean, I've been doing this for 10 years, and to think that our guys potentially won't have any dental care at all, it's really a big challenge.
Some of those policies that we highlighted tonight won't kick in until November 1st. We wanted to talk to somebody in person from the Department of Health Care Services. They sent us a written statement essentially saying that anesthesia is risky, it's tough. The new guidelines are meant to make sure they do it the right way and keep patients safe. But guys, bottom line, a lot of these special needs adults still not getting the care they need, and they say Dent-A-Cal is certainly not helping them at all. Reporting live in Sacramento, Joe Khalil, Fox 40 News.
Joe, thank you for that.